Today we're here to check out the procedures for the COVID-19 vaccination. We're at the Koweta facility here, and I will actually be getting my shot today. And we'll check with staff to find out what their challenge is and how they're meeting it and serving citizens.
So I'm Sid Daniel. I'm the health administrator here for the Koweta Indian Health Facility. And currently we're working on getting vaccinations for our population group here that's registered and active patients at our facility. Currently we've done about 1,000 vaccines to date since we started at mid-December-ish. And so that's our goal.
All right, now, is your system any different from, like, say, a federal facility? This is a federal facility, but a tribal unit like this, has any differences at all?
So no differences that I'm aware of. Obviously, they have their rules, and we kind of go by the tribal guidelines. I don't know there specifically. If you called up, say, Claremore Indian Hospital, what their guidelines are as far as tiers or phases or where they're at on their vaccinations. But so we use our guidelines from Mvskoke Creek Nation Department of Health leadership.
Okay. And when you're accepting applications for the vaccine, what sort of requirements are involved?
So we're basing our vaccines right now on phases or tiers. And so the initial phase was all of Mvskoke Creek Nation Department of Health healthcare workers. And then after we got that completed successfully, we kind of branched out to those age 65 and older, or underlying healthcare conditions if they were under 65. And then we'll hopefully eventually move out to other tiers such as school teachers and school workers, just general population that don't necessarily fall under that first phase. So currently we are still on that phase one, kind of B or C tier. We're still trying to get all of our 65 and over elder patients in. We're still trying to reach all of those underlying healthcare condition patients. So that's really what we're focused on. We're actually pretty close to that for just this facility. The other facilities are working their lists as well. And so we're trying to reach out to our patients proactively and say, you fall into this category, are you interested in the vaccine? And if they are, they come in, they get scheduled and get a shot.
When you accept a patient, an applicant for the vaccine, is there anything particular process they have to go through or information supply?
Sure. So currently, if they call us and they say they would like a vaccine, we're putting them on a list. And we're still working on the list that's developed by our information technology group that has filtered those lists of active patients. So we're putting them on those that call in. We're putting them on a list, and then once we get past our first two phases, we'll reach out to them and get them vaccinated, depending on whether they qualify for age or underlying healthcare condition or those kinds of things. If we know they're our patient, we look them up if they've called us, and we know they're in one of those categories, we automatically put them into a schedule. If they're a non-registered patient and they've called interested in the vaccine, then at some point in the next 3 or 4 weeks, we're hopeful to get to them and get them on board, and they'll register with our registration department, and we'll get them in and get them a vaccine.
Okay, now you mentioned 1,000 doses already.
Mm-hmm.
Is it something that's popular, word of mouth kind of thing? What do you hear from people who are coming forward?
Right. So it's been a little bit of a struggle too when we've reached out on our list to get the patients to accept the vaccine. We're running about a 40 or a 50% acceptance rate. And so about 1 out of every 2 calls that we make, they'll want the vaccine. And so but it has helped word of mouth for those that have received the vaccine that they haven't had any issues at all with side effects. So that really has helped us with that cause. We're getting a lot of patients that come in to say, hey, my aunt or my uncle got the vaccine. My grandma, she didn't have any trouble with it. How can I get on the list? So that's really positive, and we're looking forward to branching out once we do get to that next tier to get that done.
Okay, final question here, and before we get to the actual process. What are you hearing, I guess, from citizenship when they're first of all curious perhaps a little doubtful, and wondering how long it will take them. I mean, is the load overbearing or what?
Right. So the two-part question there. So the first part is we really aggressively tried to get our doctors and our healthcare providers to reach out to their patients, especially those with underlying healthcare conditions or 65 and older, to really promote this vaccine and kind of talk to them and give them some information about what to expect and how to get it and all of those things. We also have developed a vaccine hotline where they can kind of go through the menu. It's a self-serve menu, and it gives them some information as well on the vaccine. So curiosity about side effects and those kinds of things, it's listed on there. So what we're hearing is just a lot of positive results after the vaccine. There was a lot of concern with side effects in the media because it just wasn't known. It's a brand new vaccine. It was done very quickly. People were worried about it. So there wasn't a lot of data out there with that. But all of the vaccinations that we've been able to provide, we've had no severe reactions, a little bit of a sore arm, those kinds of things, a little headache, a little fever maybe. But for the most part, it's been very, very easy to take.
You've got people in rural situations. Are you doing some outreach there? And what kind of vaccine are you using? I know there are two types out there, one requiring special storage and cold. What have we got here?
That's a great question. So we're using both Pfizer and Moderna for the Mvskoke Creek Nation Department of Health. In particular, I don't have the sub-zero extra storage cold freezer unit here, so we've been giving all Moderna at this facility. A couple of our facilities has been able to acquire a sub-zero freezer, and so they are able to collect that Pfizer and store it properly and use that particular vaccine. They're both mRNA technology, and so really one versus the other, it's going to be the same effect. And so it just so happens that we've used Moderna, others have used both Moderna and Pfizer.
Okay, what's the next step now that we've made the contact here?
So next step for you is to get you up to registration and get you signed in, and then we'll go through the process of checking a consent form and checking your medical history, getting you to a screener, getting you vaccinated, watching you for 15 to 20 minutes to make sure you don't have any kind of side effects, and then you'll be done.
You ready to get a vaccination today?
Yeah, let's give it a shot, shall we?
Let's get a shot today. All right. So they explained to you this is your vaccination card, and it's going to be the Moderna vaccine, and that's the lot number. Today's date. You'll return on the 11th at 2 p.m. for your second vaccination shot, okay?
Right.
So which arm would you like to have your vaccination?
Let's go with this.
The left? Okay. And you just relax your arm. Just relax. No, don't stiffen up. Just relax it down. There you go. Just relax.
At this point, do you ever have any problems with people getting a shot? I mean, being scared or?
Well, they're scared,
Or
but
more.
just relax, and we just go 1, 2, 3, and then it's pretty well over. 1, 2, 3, it's over. Over. You didn't even have a drop of blood, but we're going to put this bandage on it just in case. There you go. It's all done.
Now, if there are any side effects, what might I look for?
Well, you might have a little bit of shortness of breath, but we really have had very, very few reactions. So you'll sit out here in the observation room for 15 minutes, and if you have anything, there's a doctor out there, and she will help you, okay? So I'm going to write down the time. It's 10:02, and if you can have a seat out there for 15 minutes, then you'll be free to go, okay?
Well, no surprises so far. It's not sore. So does this look normal like it's supposed to?
It looks perfectly normal, and your 15 minutes are up.
All right, great.
Any trouble breathing, itchiness, scratchy throat?
All right, well, thank you so much. We
You're
appreciate it. You all were great.